Welcome to the Expedition Chiropractic podcast, where your spine embarks on an adventure toward better health. Hosted by Dr. Stephen Barger, your severe spine specialist, we offer expert Gonstead chiropractic care right here in Port St. Lucie, Florida, serving the entire Treasure Coast. Whether your back has taken an unexpected detour or just needs a tune-up, you're in the right place. Let's get started.
Is chiropractic care safe and effective for kids? Dr. Stephen Barger discusses how early intervention can support growth, development, and immunity, even in babies. Welcome back, everyone. Millie, I'm co-host producer in the studio with Dr. Stephen Barger. Dr. Barger, how are you?
Doing great. Thank you for hosting today.
Thank you. I appreciate you for having me. Can children benefit from chiropractic care?
Yes, children of all ages, people that have a spine and nervous system can benefit from chiropractic. I've taken care of newborns just a few days old to people in their mid-90s. So everybody can benefit from chiropractic care. And today we'll specifically talk about kids. Obviously, kids, their adjustments are going to look a lot different than adults. So say I'm taking care of a newborn, baby's just a few weeks old. The amount of pressure I'll have to use on their neck region is like checking for the ripeness of an avocado. It's very, very gentle overall. They don't have really a lot of muscles or tendons holding everything into place. So you look for areas of tension in their neck, you gently put it in place, and then let their body start to relax and heal naturally. So it looks a lot different than an adult adjustment. And then as kids grow up, they start to get more muscles and stuff like that. And then that adjustment starts to develop. It looks more like an adult adjustment as they get into their teenager years. So I figured I'd start with what we're able to help newborns with today.
Yeah. So what would make a parent bring a newborn to you? Would it be some type of trauma at birth or just...
Yeah, that's a great start. So obviously the birthing process is very traumatic. And if you get through it, it is an emotional roller coaster for mom, baby, and father as well.
Yes.
It is an emotional roller coaster. Yeah, so if there's any pressure on the baby's neck when they are being delivered, there can be small misalignments that put pressure on their brainstem, on their spinal cords, on the nerves around. And if there's any pressure on that, it can cause the baby to have different symptoms. The most common thing most parents bring their baby in for would be a torticollis. A torticollis is like they favor one side, always looking to one side. So say if the baby's always looking to the left, they're not going to eat well on the right, or there's always going to be favoring that one side. So that would be a really common thing that we're able to help newborns with. So look on their neck, any little areas of tension, usually, again, in the atlas region. You put some general pressure, and then over the course of 2 to 3 visits, they're usually able to balance their head out, and then they're able to eat better on the other side and things like that. Another common one, obviously, would be like colic, very fussy baby, stuff like that. Whether they have digestive issues or they're just crying a lot, we're going to really want to make sure that we're able to help those parents, help that baby calm down and make sure that they're not as colicky. Some common things we'll see is like they're not comfortable on their belly a lot. That would be a thoracic issue, that babies are really hard at like arching, or they look really, really uncomfortable when they're doing their tummy time. Those are very easy fix. We just look in that thoracic spine, usually see a little area of tension. We put a little pressure on that, and those clear up really fast as well. The good thing with newborns are they don't have a lot of stress or tension on their body, so they heal a lot faster than us adults, where we have the stress of work and kids and life on us. So it takes more visits for adults, but generally babies and children are able to heal very quickly, which is really good. And then obviously like digestive issues, going to play into like colic as well. If they're constipated, they're going to be crying more and fussy more and stuff like that. I've had babies before, we adjust them in the office and they will poop their diaper before they hit the door on the way in. So those are really cool and special when you're able to help those babies. And it really helps the family and the parents the most, because if you've had a crying baby for a few days, it will take an emotional toll on you. So helping those families try to get back to normal and have a comfortable baby is a big joy in what I'm able to do every day.
Oh, especially since they can't speak for themselves. So let's move into children and even teens. What types of things do you see improve?
Yeah, so in toddlers, a real common one with like toddlers would be like ear infections. So in that 4 to 5-year-old range, we live in Florida, so a lot of kids swim and stuff like that. So they get that water built up in the ear, and in our body, the eustachian tubes are at a really shallow angle. So sometimes they will get clogged up, and that's why kids get more ear infections. As we become adults, they grow and they kind of go more angled. So they eustachian tubes in our ears flow into the back of our throat a lot better when we're adults. But kids are very shallow, so they can get clogged very easily. And sometimes, again, the atlas is misaligned. If it misaligns forward, it puts pressure right in that eustachian tube and can cause it to get clogged and have those reoccurring ear infections. A lot of times, those kids often go like or something like that, and they'll get these reoccurring ear infections, and eventually might have to get tubes put in or something like that. So if we can do something more natural, we're able to just take pressure off the eustachian tube, probably more than likely from the atlas, and allow those to start to clear properly. That will obviously help children a lot as well. And then also with toddlers, the most important time you can take them to see a chiropractor is if they see any regression in learning or milestones. So you have a child that started walking, he's been walking for a week or two, and then all of a sudden he does not want to walk and he starts crawling. Those are really, really important times. You do not want to see a regression in learning at all. You really want to make sure that they're hitting their milestones, that they continue on that trajectory. If there's any regression for even just a week or two, it's important to get those checked out quickly so that they don't develop any other milestones or start skipping things as they grow up to be adults. Because if you skip those milestones and those foundational blocks early on, they can become other things later on, digestive issues, headaches, or a lot of other things when they become teenagers or early young adults, things like that.
Absolutely. So can chiropractic care help children with behavioral or attention issues?
Yes. One of my favorite patients ever was a 4-year-old little girl. She was an absolute princess in the office, but the parents would say that she'd go home and just have 1 or 2 hour long, just like attacks of just like rage. I was just like, this little girl, I'm like, there's no way. But we worked with her for a couple months and were able to get those calmed down a lot, but her nervous system was just fully loaded. But in particular was adopted. Her mom, I think, her original mom was on a lot of drugs, and then she had an adopted family that was bringing her into the office. Gotcha. So for her, she had a lot of trauma early on in her life, and like when she was 1 or 2, and then that started to develop into like behavioral issues when she was 4 or 5 years old. In those cases, we're able to just calm the nervous system down. A lot of times kids, their nervous system is just way too much. They have way too much sympathetic activity, what we talked about in the last episode. Sympathetic and parasympathetic nervous systems. So we'll do tests to see how their nervous systems are working properly, and then make sure that we start to balance those out as well. And that would generally be in that like 4 to 6 to 7-year-old range is generally ideal, good times to see for that. And then as kids start to get older, the most common thing we'll see like the young teenagers or 10-year-olds would be scoliosis. A lot of times we're going to want to check kids for scoliosis, 8 to like 13-year-old range. Between like 11 and 12, that's when their kids are growing a lot. That's that prime time that scoliosis can develop a lot and get really severe. So we take a full spine x-ray of almost all of our patients. So we're able to really help kids obviously check for the progression of it, see how it's going to get worse. But we really want to make sure that not necessarily even fully correct the scoliosis, but make sure it doesn't develop into anything a lot later in life. If we have a 50-degree curve, a really severe curve, the child doesn't have any pain symptoms, they're athletic, moving around, we're going to obviously want to reduce that curve a little bit, but want to keep them mobile and active for as long as possible. And if they say they still have a 40-degree curve, but they're very active and no other symptoms with it, they can live with that curve the rest of their life and have a very active lifestyle. So it depends on the case. But yeah, we really want to make sure that we monitor the scoliosis, reduce it when we can, and keep a child happy with no other conditions arising from the scoliosis.
How often would you say children should be coming in and checked by a chiropractor?
Yeah, so early on in life, like once a month is ideal, especially when they're growing a lot. They're having a lot of developmental milestones in those first 18 months of life. And then once a month is ideal. I check my child every week. And it depends on the child, how much stress and trauma they've had. If they're 4 or 5 and they're having developmental issues or speech issues, they're going to have to be seen more often. And the child that was adjusted from birth and they might have no issues at all, you won't have to check on them as often. Generally, once a month is pretty good. And then if the childs are developing well and they get through the first year and a half of life fairly smoothly, you can go to every other month or so would be good.
Well, at first I was just so perplexed at the idea of chiropractic care helping with these types of things, but we've heard the term that trauma is stored in the body. So now it just makes a lot of sense when you describe it like that. You might be saving some them kids some therapy down the line.
Yes, exactly. And then another common one we see in like that 10-year-old range is kids will start to get headaches around that time. And like no kids should get headaches really. There should be so little stress and trauma on their system. There shouldn't really be any headaches or really severe migraines arising. So those are usually pretty easy fixes as well, but you don't want your kid to have to start taking a leave, your migraine at a young age that are just covering up the symptoms. And eventually they get that nauseousness and sickness every month or two or so because they get those severe migraines. So those are common things we'll see as well with that preteen age.
Well, I hope this episode really encourages more parents to come by and see you specifically. Thank you so much for all that great information. Catch you on the next episode. Have a great
Thank
day.
you. Yes.
Thank you for joining the Expedition Chiropractic podcast. Ready to set your spine on the right path? Visit expeditionchiropractic.com to request an appointment or call us at 772-245-7069. Here's to aligning your spine and your life. Until next time, keep moving forward.